I was either going there to help my son with recovery, or I'm going there to pick up my 1-year-old son to bring him back to Virginia to bury him. We were in South Myrtle, so this was September 6th, 2021.
He was eating. Him and his sister were sitting there. He was in his booster seat.
Literally, I'm facing the laptop. She's over in the, like I said, about 20 feet away, and all I hear is just a scream.
I was sitting next to him, cooking his eggs. I turn around, and he threw his head back, and the whole booster seat fell over with him buckled in it. I was right there, so I quickly grabbed him and looked to see, put light on his eye and make sure it was reacting, and felt his head for any bumps, anything like that. It just, it seemed totally fine.
Initial fall probably happened around 9:30 in the morning. Then we went to the pool.
Look at you, Sandman.
I mean, swimming, everything's completely normal.
Sanders winning. And he played and he had fun. You're winning too? It was nap time, and I never let him nap with us. But for some reason, I let him nap, because Skylar, his sister, was playing at the pool. He threw up a little, and that made me a little nervous.
Visibly could tell something wasn't right. He started to get more pale than normal.
He was sleepy, but it was nap time, but it wasn't normal sleep, I felt. And so I was like, I don't care, I'm going to the ER. And by the time I started to drive to the ER, I don't know why, I just started freaking out. They literally met me at the door because I was crying, and I handed him over. And so they took him, got a scan. Within minutes, they saw that there was blood in his brain. At that point is when they called the transport team at MUSC.
We initially received the call from Conway via our ATC service. It was sort of later in the back end of my shift. I think I had an hour or two left. When I saw the images, I had paged neurosurgery already, just sort of as a routine, receiving a kid that was going to have some sort of known head trauma. When I saw the images, I paged more.
I was at home, outside, not near a computer. I got a page saying that there's a kid that potentially has a trauma, a head injury. So I called back and talked to the emergency department. It was Dr. Moak.
So I gave him sort of the general description of the kid and what had happened, what was initially described to me, and then what I was looking at in the images, and was sort of making measurements through the software and describing those to him.
Well, there was no one around me, so some curse words were said, because it was probably one of the largest epidural hematomas I've ever seen. The first thing I did was call Dr. Moak back and let him know I got the pictures, that this was not a transfer to the emergency department, and that we had to think a little bit differently.
In this case, based on the mechanism that was sort of described, the injury that we knew we had and how bad it was, the discussion between me and Ramin was to sort of, can we bypass that process and get this kid straight to OR, knowing that sort of every second was going to be critical.
At that point, literally it was him. It was his entire plan. He got the AirMed number, he had their phone number, they had his phone number, they were communicating throughout the whole. He was sending me messages, he met them there and literally escorted them down. There was just no delay. Everybody knew they had everything ready. The instruments were all ready on a tray. We've picked the 5 instruments we're going to use for the first 10-15 minutes of the case. We had everything just ready to go. Everything was plugged in, and I think within 7 minutes or so, we had the bone off.
It was the longest, worst drive of our lives. I just hysterically cried the entire time. My husband drove and tried to keep me calm, but obviously he's torn up inside too.
So I was actually pretty cool on the outside, but I was like a crazy madman on the inside. We are 20 minutes from Charleston and the doctor called.
He told me that the surgery went well, which made me feel a little better.
What I told the parents is that so far we got all the blood out, and we know that the brain was under pressure for some time, but we're hoping that it was not enough time to cause injury. And so I tried to give them some level of hope that as they're kind of getting closer, they can not stress out as much and things went well. When we finally got repeat imaging is when we knew that everything worked out really well, and he had no hemorrhaging, no strokes, no injury, nothing.
The next day when he put the scans up next to each other, it was like it never happened.
It's an absolute miracle. Like it's like we don't see this ever this fast.
It's only been like, what, 3-4 months? It feels like a lifetime ago. You would think that it never happened. He's back to him, everything. Like, he definitely doesn't think anything happened.
This never would have went well had Sanders' mom not been a mom first. It's probably the one thing that saved his life is how quickly she arrived. And that hospital's ability to get scans, call us, transport quickly. I just can't emphasize enough the level of teamwork that it took to make a good outcome happen.
When you look at all those moving parts, all those people involved, it's just like when you think back on all those little things that really needed to work, he's just a little miracle. I mean, it was a miracle to get him into the hands of people who really could perform a miracle.